turn it over to Bill. Bill is our definite program expert. And so, like I said, I'll just introduce a couple things. As far as roles here in Wyoming, like I said, Bill's going to talk a bit, but I wanted to introduce myself and then also Kaylee, who's on the call. So I work here in Wyoming as well as in several other states in cancer center partnerships. And then Kaylee Vangelovic, who is also on this call and does a lot with coalitions, works here in, let's see, her title is Associate Director of State Partnerships. So she does a lot with coalitions, working with the state and a lot of other tasks as well. So between Kaylee, myself, and Bill, we're kind of your crew here for Wyoming. Next slide, please. So I'm just going to go over just a little bit of broad stuff about American Cancer Society as a whole. American Cancer Society is very focused on taking care of patients and also caregivers, knowing that caregivers really bear a lot of the struggle as well when someone they love is going through treatment. Next slide. So this is our vision and mission. American Cancer Society has had some great changes in the recent past as far as like revamping their branding, revamping what they want to focus on, making sure they're being really inclusive with a lot of groups, having a health equity focus, a lot of things like that. So our vision here is to end cancer as we know it for everyone. So that's all kinds of cancers, all kinds of persons. So our mission is to improve the lives of people with cancer and their families through advocacy, research, and patient support to ensure everyone has an opportunity to prevent, detect, treat, and survive cancer. And I will tell you, this includes all things across the cancer continuum. So everywhere from your prevention, early detection, support during treatment. They do a lot of research. We don't talk about that as much here in Wyoming, but research is a really big part of ACS as well. A lot of stuff with palliative care, working on symptoms while people are going through treatment, survivorship, and then the end of life care, if that becomes necessary. You can see on here also mentioned in the middle of our American Cancer Society Cancer Action Network, sometimes called ACS CAN. And those folks do a lot of great work with lobbying, with legislation, kind of advocating for patients and their families to make sure their needs are being met as best as possible. Next slide. So I will turn it over to Bill here, and he's going to go over a lot of our programs.
Hey, thanks, Jana. This is kind of like a highlight of the big buckets of our patient support programs. The top of the list is our National Cancer Information Center, or we refer to it as NCIC, but this is our call center. So the 800 number that is open 24 hours, 7 days a week. So I've also got some information with online communities and support that can be done for, which will work well for patients. I mean, especially with our Wyoming vastness that we are, like that not everybody is necessarily very close to a resource, but having that online support is a great option. So Reach to Recovery program, our Road to Recovery program, and the lodging programs. You can take me to the next slide and actually skip to the next one. There we are. So National Cancer Information Center, the NCIC is a great resource. Our trained specialists that are there will help provide information. I highlighted a few of the other options that are there that aren't necessarily immediately thought of, but that we do have specialists that can help with like health insurance assistance questions. I mean, like sometimes navigating if you need to, you need some support or advocacy getting through juggling through health insurance like stuff. So we've got specialists that can help do that. The Cancer Center, the Information Center is set up as other options besides phone. Is that it can also be email or live chat is part of the process as well. The specialists will refer to resources that might be once they've started connecting with what that patient might need, and that's patient or could be caregivers too. We have lots of phone calls that come in from caregivers. They're there as emotional support, and whatever's needed 365 days a year. So over 1.4 million inquiries each year come in, and that's by phone or email or the online chat that I was talking about. We do also have language support like stuff. So over 200 languages can be supported if people need that help with a language barrier. So now take me to the next slide. We can talk about some of the online support. We have a program that's for cancer survivors that is that network that divides up and puts into chat groups people that are similar cancer types, or caregivers are also included in that. They have a branch in there too, but it can be a specific like group that they can get with and connect as they're needed. The other online supports that are there that connect with our website like thing is there are survivorship guides, different basic, lots of information that that can be referred to. There is some incredible caregiver supports like that don't get used near enough. Like thing for the video supports that are there are fabulous when it comes. I mean, like one particular example is like sometimes people need help with caregiver might need help with a feeding tube, but like that there are videos to help them get through that, because you see all that stuff and are sent home with a great resource coming from the hospital. Sometimes you need that little bit of extra support to get there. So there's some great video support that's there. And then we also have the bookstore there that's general information kind of stuff that's there. I'll take the next slide. This is going to speak to our ACS Cares program. This is brand new. This program is a multi-channel approach that leverages digital as well as telephone and in some areas that will even be online or in-person support, I mean. This is direct, individualized, non-clinical support to help that patient through their cancer journey. So it's an app that can go on their phone, but you're putting in or customizing it to type of cancer. It will provide the information for you based on your needs, like so, and be very specific with their cancer journey. So brand new, actually just launched September 1st. So it's just in the infant stages. So we're excited about how that program is going to grow. Next slide, please. Reach to Recovery has been around for a while. This one is a support network for breast cancer patients. So this one is a program designed around connecting a breast cancer patient with a volunteer of somebody that's been there, try to match it as similar diagnosis when we can, or that had a similar treatment plan, something like that. This is done virtually, but it's a one-on-one connection that's made. So in some of the instances, people do just like a chat sort of like thing, but it can also be emails, or if they want to set up a phone call kind of like stuff, it's up to the individuals as how they'd like to and the best way to connect and interact. So they have several options within the Reach to Recovery program. The next slide will take us to our TLC program. This is Tender Loving Care is a catalog of supplies for mastectomy and hair loss. So it's there are catalogs available like for we can send you some if you want to have catalogs on hand, be able to share with the patient, or they can also access it just by calling into the website, or calling into the 800 number, or visiting the website. The trained customer specialists that answer those are great at helping matching the needs that the patient's looking for. So it's one more resource for where there may not necessarily be a WIGOT close, but an option for some of the more rural patients that might need help. So the next slide is going to take us into our you can skip one more, transportation programs. I'm going to highlight the transportation. It takes on many different roles like stuff, but one of the programs that we have, why don't you take me one more slide? It'll be our Road to Recovery program. Is a group is volunteers that will help get cancer patients to medical appointments and treatments. For Wyoming, we have actually active programs in Lander and Cheyenne. Both markets are still recruiting drivers to be able to supplement or grow those programs. But it's basically with that program, it has evolved into, again, it's for those that you just call into the 800 number to get connected with the program. And then patients have the option with that they can use an app on their phone if they're tech savvy and comfortable doing that. That they can set up their own rides. Like, so once they got their treatment plan in place, they can plug in their ride requests, and it'll then reach out to, it puts the information out for our drivers that will connect with what rides they might be able to support with. If the patient is not tech savvy or doesn't have a cell phone, something like that, our 800 number, calling into our NCIC, or that main 800 number, we still can manage those calls and take and plug in all of that information for them if they patient should need that help. Next slide. This one is just the ways to help promote or growing the program, like stuff. That it's a continually evolving program, like because currently our Lander and Cheyenne programs are only filling about half the ride requests that are coming in. So we need to get more drivers in to be able to keep growing that stronger. Take me to the next slide. This one, the other aspect of our transportation program is we have a transportation grant program that these funds are provided to health systems to help cancer patients with those transportation barriers. These grants are awarded through a competitive process, and they focus on addressing those transportation needs. For the markets that have a road recovery program, like Cheyenne as an example, the road recovery program works in addition to that. It's just one way that those grant dollars can go even further. They use the road recovery program first, and then can add in or supplement with whatever the transportation programs that work for their system. Those grant programs are annual process, like stuff that we run a year-long grant that starts in April. The application process for that will start mid-December into January for when the applications are due. Let's skip to the next slide, and there's a title slide. We want to skip one more there. Thank you. Lodging is the other huge barrier, like stuff that many patients can't follow their treatment plan if they can't stay there because of the distance involved. If you want to take me to the next slide, it's going to speak to our Hope Lodge program. So this is a location like for a home away from home sort of feel. We provided more than 6 million free nights of lodging. In 2022, the full year numbers, 115, this was just coming out of COVID. So 115 Wyoming patients stayed with 1,670 free nights of lodging at Hope Lodges. So even though there is not a Hope Lodge in Wyoming, it still is impacting the Wyoming patients. For 2023, we've already met those numbers of what we did in 2022. So with 106, this was through July, 106 patients served with the almost 1,700 nights. The closest lodges that we have for Wyoming would be that there's one in Salt Lake, which is used frequently, or then the other one that gets lots of use is the Mayo Clinic for those that go to Minnesota. Next slide just speaks to some of the features of Hope Lodge, like so that they're staffed with there's ACS staff there, but there are also volunteers that help support. Patients have private rooms with they have a community kitchen area to be able to cook their own meals, laundry facilities. It's a great program to network and find other cancer patients to be able to connect with, and lots of resources and information that's available through the Hope Lodge. Next slide is going to take us through that. There's Extended Stay America is one other program that we have with lodging. That this is a national program. I've highlighted some of the locations that are somewhat close to Wyoming. Like, so if you have patients that are traveling, Billings has extended stay. Salt Lake has extended stay. Denver has quite a few extended stay. This program is one that a partnership with extended stay that they allow free nights of lodging for patients like that they and to access these, they call into our 800 number and are connected with the program. Currently, we have exhausted all of the free nights that we have. That contract is kind of being re-upped or renegotiated right now, like things like. But what extended stay is doing for us is what you see as the second bullet, the one where they're offering a 45% discount for all patients. That the free nights have been exhausted, but they can still it's unlimited number of like with that 45% discount it is. So and this one is really just a referral with a phone number. Like so they call into our 800 number and they will get a URL code and can log into the Extended Stay America, plug in the just like you're booking online with any of the other online hotel booking situations, like things, but it's a code that will allow them when the program reactivates, and we're expecting that to be very soon in the next few weeks that will reactivate for the free stays. That they're just finalizing those the agreement like stuff for. I think I've got one more slide yet. So similar to the lodging grants, or sorry, the transportation grants, we also have a lodging grant program which does the same thing of providing lodging opportunities for patients that might need to come to a facility and stay. That they have the opportunity for that system to provide a hotel stay for them. And I think that so it's just a chance for questions.
Thank you for that great overview of all those services. It's amazing that we have all of that available. It is crazy how fast it gets used up, especially those lodging stays. So I'll be excited when that gets kind of renewed. So thanks for sharing all that. Any other?
That extended stay program. I mean, there was 20,000 free nights that they provided for us, like things like so. It's a pretty awesome partnership that there and it's an annual contract, like things. So as with anything, like so you just got to wait for the contract negotiations to finish to be able to reactivate that program.
All of those processes and paperwork. Don't envy you, but that is awesome. All right. Any other questions for Bill and Jana?